My name is Jasmine Ivanna Espy, and I am a hidradenitis suppurativa advocate, journalist, and filmmaker. I first developed hidradenitis suppurativa when I was 11 years old, and I was diagnosed by an HS specialist. One of the symptoms that I got was raised skin. I had a boil the size of a golf ball under my right armpit, and it was red, tender, and extremely painful. The first time I got diagnosed with hidradenitis suppurativa, I didn't consider it as an accurate diagnosis because treatment didn't follow. They only speculated, and that really didn't provide me with any information to move forward in managing the condition. So the time that I did get officially diagnosed was 3 years later, when I was in high school. The physicians explained it as a condition that was incurable, which was heavy. The second thing they told me was that it was recurrent boils and cysts in places that skin touches skin. By this time, my whole body was covered, so I wasn't really worried about it spreading. However, we do know now that HS does not only present in places that skin touches skin, but it can really appear anywhere on the body, which is concerning. HS affects my daily life significantly. It is a burden on every aspect of my life, from what I eat to my ability to perform activities, to working, to what I dress, what I sit on, how I operate. It's just from top to bottom, it affects everything. I would say the most difficult part about dealing with HS, especially as a woman, is dealing with it in the groin area and the buttock area. That's where it mostly affects me now. I unfortunately got a plastic surgery about 4 years ago. It was a reconstruction by a urologist, and he botched my vaginal area where he was trying to remove some of the HS. And so I've had to deal with that area where he did the stitching breaking apart during the pandemic. And it has been extremely devastating on my mental health and my ability to feel like I'm a woman. It's really worn down on my self-esteem, and I've really had to work to love myself in my body, but also love myself outside of this body, and know that I'm more than what is appearing on my skin. I'm more than just my body, which is really surface level and difficult to really commit to, but it's something that I work on every single day, and it's not easy at all. Being an HS advocate helps me to reduce the shame that I feel with HS and really provide space for myself to exist in a world that really tells me that I shouldn't, from being a woman to having a chronic illness and to being Black. HS does affect my relationships. I have really seen it affect my familial relationships and my friend relationships, but not in the aspect that you would think. It's not because anybody rejected me, it's really because of my own emotional and personal issues and battles. When I first developed HS, I didn't really understand what I was going through, so it was a lot to process at the age. I was 11. You can only imagine what it would be like to have boils in open skin and drainage and scar tissue constantly. And this is not like a once every couple of months thing. It's like every month, almost. It felt like every week, honestly, that I would get a new boil on top of a open wound. So imagine that. It's terrible. I share my HS story for the 11-year-old girl that was never able to have agency over her body. When I was that age, I felt lost, I felt confused, and all I wanted was community, and I just really wanted to be held and told that I was valuable. And that's why I do what I do. That's why I tell my stories, so that other patients don't feel shame, so that they don't feel isolation, and they don't feel like they're a burden, or they don't feel like they're not wanted. You are wanted, and it doesn't matter if you don't fit to some beauty standard that is unrealistic, that this world can't even match to. what really matters is that you know who you are as a person, as a patient, as a being. You are more than your body, you're more than your experience, you're more than your chronic illness. And I think that every patient needs to know that.